Why physical exercise is vital for a healthy brain and body. Physical fitness through exercise is one of the most common pieces of advice offered by medics across the planet. There are many benefits of exercise when done correctly. Some of the most common include improved blood flow, general body fitness, weight loss, and stress relief. This video seeks to focus on some of the direct benefits of exercise on the brain and the body. So, exercise and the brain. Well, according to an article published by the Harvard Health blog, exercise helps the brain both directly and indirectly. Physical activity reduces insulin resistance, inflammation, and stimulates the release of growth factors in the brain that affects the growth of new blood cells. These growth factors also encourage the abundance and survival of new blood cells, keeping the brain healthy. Indirectly, it improves brain activity, which also improves mood and sleep, and reduces stress and anxiety problems. So, physical exercise has been proven to have some of the following effects. Number 1. Boost the memory. Studies conducted on the hippocampus among children, adults, and the elderly show that the brain structure grew after aerobic exercise. The hippocampus is part of the brain that holds the memory and is therefore crucial for learning. Number 2. Improve concentration. Exercise improves the ability to focus on one task, ignore distractions, and also hold and manipulate information. Aerobic exercise improves retention among students and therefore crucial for children, adults, and the elderly as well. Number 3. Improve mental health. Physical exercise is a great mood enhancer. The feeling of elation experienced after exercise is real and should be used as an alternative stress reliever. A 2010 study conducted for 8 weeks showed a significant decrease in the amygdala after yoga and meditation. The amygdala is part of the brain that is implicated in processing stress, fear, and anxiety. Number 4. Slowing cognitive decline. Physical exercise delays the onset of mental wear and tear and dementia, especially among the elderly. It pays to exercise early in life to avoid mental illnesses that come with old age. A study published on the neurology suggested that women who are physically fit in their middle ages were 88% less likely to develop dementia than their peers who were only moderately fit. 5. Physical fitness and weight loss. A study published in the Indiana Journal of Endocrinology and Metabolism showed that an active exercise training program was ideal for reducing weight and improving physical fitness among obese children. The effects were possible even without a change in dietary composition. Number 6. Protection of the body against age-related decline. According to a study published in the Journal of Aging Research, it suggests that physical activity maintained throughout life is accompanied with a lower risk of developing chronic conditions such as cancer, diabetes, cardiovascular, and coronary heart diseases associated with chronological aging. Number 7. Improved heart and lung health. When done on a regular basis, physical activity, both moderately and intense, lowers the risk of developing coronary heart disease. Regular exercise strengthens the heart muscle and its ability to pump blood to the lungs and the rest of the body. The lungs automatically pick up the pace to keep up with the exercise and therefore become stronger as well. Number 8. It increases lean mass and strength. High-frequency training and low-frequency training both contribute to improvements in lean mass and strength in men and women. Strength training also helps alterations in metabolism, increase in bone density, reduce the risk of injury, and even rebuild lost muscle. The buildup of muscle is necessary for preventing a resting metabolic rate that causes obesity. High-frequency training and low-frequency training both contribute to improvements in lean mass and strength in both men and women. Number 9. Improved cholesterol levels. Regular physical activity and exercise are effective in lowering cholesterol levels in the blood and thus preventing the onset of coronary heart disease, heart attacks, and strokes. Clinicians recommend aerobic training or resistance training to ensure that healthy cholesterol levels are achieved. Number 10. Prevention and management of diabetes. Regular exercise can help delay or prevent the development of type 2 diabetes by 60%. Daily physical activity, aerobic training, or resistance training prevents sugar buildup in the blood. Insulin sensitivity increases and the body can take up glucose during and after activity. Any form of physical activity that helps the body burn calories, e.g. walking, cleaning, running, sports, is beneficial and should be included in daily routines. So in conclusion, daily physical activity and a variety of exercises have significant improvements on the brain and the body among children, adults, and the elderly. Therefore, it is important to include regular exercise in our daily routines to maintain a healthy body and also to prevent lifestyle diseases.